Hello, welcome back to this channel where we talk about the basic medical information making a big difference. We have been talking about the thyroid, and in this channel we like giving information, all getting information which will make you get to know what to do if you are faced with a certain medical condition. If this is your first time, kindly subscribe. And if you are a returning subscriber, thank you so much for always coming back to watch my videos. And my name is Rebecca Morangi, and this is the best place to be. As I said, we have been talking about the thyroid gland. We have made several videos. First one being the introduction of the thyroid. The second one was how the thyroid gland connects with other glands in the body. We looked at the disorders of the thyroid gland. And the last one, we looked at one of the disorders of the thyroid gland, where we looked at hyperthyroidism. Today, we are going to look or to know how the condition is managed or treated. If you remember, we summarized by saying hyperthyroidism can be caused by several, or it may be caused in several ways. Why do I refer back to this? When managing this condition, the first thing the doctor has to do or to look at, the first thing is to look at the cause. What causes this, or what has caused this condition? Another thing is to look at your health or your age. Finally, it comes as a result of the patient's preference. As the doctor looks for one of the ways to manage your condition, you come part of the solution, especially when somebody has thyroid condition. This one we'll get to know more, and the reason as to why you become part of the decision making. Now, I was mentioning on the causes. One of the things the doctor looks at, what could be the cause of this? And we looked at several ways. One was, it could be as a result of what we call Graves' disease, which is an autoimmune response. It can be caused by thyroid nodules, which are lumps, can be lumps in your thyroid. Another cause was thyroiditis, which is the inflammation of the thyroid. Another thing could be caused by postpartum thyroiditis, reason being this condition comes after somebody has given birth. It can be caused again by excess iodine in your blood because of the diet you are taking or the medication you are taking. It can be caused by treatment of hypothyroidism, which can, as a result, bring this condition, hyperthyroidism. The other cause was the benign tumor in the pituitary glands. So after the doctor has assessed all this, he can decide to choose one of the treatment options. Now, let's look at the treatment options which are available. One is by the use of anti-thyroid medicine. Anti-thyroid medicine, they actually ease the symptoms of hyperthyroidism, which will lower the amount of thyroid hormones produced by the thyroid gland. And the medication available, we have methimazole or capimazole. These two are used interchangeably because methimazole or capimazole is completely metabolized or changed to methimazole. Reason being the doses used, which can be used to bring an effect of capimazole, it's 40% higher. So it's changed into methimazole to bring an effect in your body. Another medication is what we call propylthiouracil. So depending which part, in the part of the maybe country you are in, you can get these medications. Now, most of the people know capimazole, which I've said is used interchangeably with methimazole, which is 5 milligram. Now, another thing, methimazole is preferred than propylthiouracil. Reason of the side effects. It has minimal side effects. Now, which other treatment option is available? The doctor actually can decide to do what we call thyroidectomy. Thyroidectomy actually is the removal of part of the thyroid or complete removal of the thyroid gland. Now, thyroidectomy actually can bring again other problems. So it will depend. Which are these problems? Problems can be, it can affect your vocal cords or remove the parathyroid glands. These are 4 glands behind your thyroid glands responsible for controlling what we call calcium in the body. So, if the thyroid gland is removed completely, you have to be in a lifetime use of thyroid medication. And here mostly they use what we call levothyroxine. Why? Here there is no thyroid gland in your body. Now you have what we call hypo condition, hypothyroidism, of which we are going to look at it after we are done with this. Now, this levothyroxine will be responsible to supply your body with thyroid hormones, which are very important in your body. So levothyroxine, depending the brands available in the market, mostly have what we call urothyrox. And again, it will depend in which part of the world you are in, because different brands, we get them differently, because we have different companies producing different brands. So levothyroxine will be one of the medication which an individual will use in lifetime to enable your body to get what you call or to produce the thyroid hormones required by your body. Another problem we said that it could bring a problem by if the parathyroid glands are removed during surgery, and which can be maybe as a side effect. Now, again, these parathyroid glands, the 4 glands behind your thyroid, they are responsible in ensuring that the level of calcium is okay in your body. Remember we said the thyroid is responsible in balancing what we call calcium level. Now, what will happen if these parathyroid glands are removed during surgery? So you have to be again in medication, maybe calcium medication, to ensure that calcium needed in your body is in a continuous supply. Another treatment option is the use of beta blockers. Here again, they lessen the symptoms of hyperthyroidism. Remember we said the tremors in your hand, rapid or irregular pulse of the heartbeat. Now here, the beta blockers, commonly here, there is one of the medication we call propranolol. This is the one which is used in most cases because it actually goes through, or it passes through the CNS. So that is one of the condition again, or the treatment option. Another treatment option can be the use of radiation therapy. Radiation therapy here, you remember we said they use what we call iodine. By the use of iodine, you have iodine 131. Iodine 131, what happens? When they use iodine, your thyroid will absorb this iodine. Tissues in your thyroid will absorb iodine, which will make the thyroid gland to shrink, and which will reduce the high amount of thyroid hormones produced by the body. It will go low, or it will slow the amount of thyroid hormones produced by your thyroid gland. Now, we have looked at four treatment options. Use of antithyroid medication. By the use of radiation therapy, the use of iodine, an example of iodine 131. The use of beta blockers, an example of propranolol. And we have looked at thyroidectomy, which is the removal of part of your thyroid gland. So if they remove a part of the thyroid gland will remain, which will continue producing or releasing the thyroid hormones. But if they remove total thyroidectomy, they remove all of the thyroid gland, you have to be on a continuous medication of the thyroid, an example being levothyroxine, to enable your body to get thyroxine, or they will release thyroxine hormones which are required by your body. And by bad luck, if the thyroid, which could be a side effect, they remove parathyroid gland, we have said you have to be on continuous supply of calcium medications. Reason being, your body will not be able to get calcium which is needed to ensure your body functions well. When it's good to conclude this by looking at, remember we said one of the symptoms or the physical symptoms of hyperthyroidism is the protruding of the eyes or the bulging of the eyes. And remember we said not everybody has this or gets this symptom. But what if you are among those who have this symptom or the thyroid eyes? How do they manage it? Actually, this is when the tissue or the tear glands in your body or the fatty tissues in your eyes get inflamed, causing the eyes to do what? To bulge outside. Now, how do they manage this? I've mentioned of the tear glands. The tear glands, if they are inflamed, you have to be in medication. This is where your eyes, they have to get lubricated well. Now you are given lubricating gels, or you are given something to ensure your body, because you remember when you cry, your eye has to remove some tears, and when you don't have this, which are very important in lubricating your eye, how your eye functions. You have to be given some artificial tears, and most cases we get to use what you call tears natural. Depending, you have tears natural and many other brands in the market. And again, the doctor can decide to do what we call surgery. Here, they have to remove what we call the bone between the sinuses and the eye socket to give your eye room so that you function properly. Again, this condition again can cause what we call blurred vision. So again, they have to do surgery on the eye muscles, because a muscle in your eyelid can become short. One muscle or more muscles all become shortened, and then causing your eyes again to bulge outside. So you have surgery can be done to repair this, which brings what we call double vision. And in most cases, you get people using glasses. When people use glasses, it's not for beauty. Others, it's because of the problems they have. Because when you have this condition, thyroid eyes, some cannot look into bright light because it affects them. So you are given glasses to manage this condition. So thyroid eyes or thyroid eye disease can be managed with those options: either surgery, eye gels, artificial tears, or surgery of the eye muscle. So at least each and every condition or problem can be managed. So when you have this hyperthyroidism condition, it's not the end of your life. Life can continue by using either one of the treatment options. And remember, I said the patient becomes part of the treatment option or part of the journey. This is where now you have to discuss. After mentioning all these management options available, you become part of the problem solving, because you have to discuss and come into a point of conclusion of which type of treatment will be good for you. Remember, we said some conditions in life, like pregnant women, some of them cannot use this radiation therapy. They cannot use some medications because they can be toxic to the condition they have. So each and every treatment is not okay to everybody. So it will depend with the type of condition you have or the type of situation you are when you have this thyroid problem. Up to this level, I believe we have gotten something. And actually that one brings the conclusion of the discussion on the hyperthyroidism condition. Kindly give the video a like, share the link, and ensure you don't miss the next video, because we are going to look at the next condition of the thyroid. We have looked at hyperthyroidism. We are going to choose one. Maybe it could be hypo, or the thyroid nodules, or goiter as we move on. Thank you so much, and I appreciate those who have been logging in or tuning in, getting connected to my videos, because this, if you have information, I believe information is power, and this can solve many of the problems as we live in this world. Thank you so much, and let's meet in the next video. Bye bye.